Welcome back to the Asthma Education Home Study course. My name is Brian, I'm the lung coach, and today's lesson, lesson 7, will be about anti-inflammatory medications used to treat asthma. Now, inflammation, as we discussed earlier, is one of the major components of asthma. It's one of the three, so it is one of the things we aim at treating when we use medication. Certain medications include corticosteroids, leukotriene modifiers, IgE modifiers, and methylxanthines. Now you may be saying to yourself right now, oh, I don't know what any of those mean. That's okay. Your doctor is going to choose which type of anti-inflammatory medications you use and which best suits your asthma. I'm just going to cover real briefly about what type of drugs you may encounter. When you talk about corticosteroids, there are certain drugs like Qvar, Pulmicort, budesonide, Advair, Dulera, and other combination drugs that include inhaled corticosteroids. Steroids are used to treat the edema and the inflammation in the airways, one of the three components. So, your doctor may prescribe you inhaled corticosteroids. He may also decide, if you have allergy-related asthma, to give you a leukotriene modifier. One of the popular ones is known as Singulair. And what this does, leukotrienes are part of the inflammation process that's released when you have an inhaled trigger. It releases in your lungs and causes inflammation, so they may use a leukotriene modifier. Singulair is the most common one I've seen. IgE modifier is another allergy-related medication. What this does is it prevents things like histamine and leukotrienes to even be released in the lungs. It actually binds to the allergen and prevents the inflammation, so it treats it a little different. It actually prevents inflammation. So you may see things like Zolar. Zolar is a popular drug prescribed as an IgE modifier. Now, methylxanthines is one that you probably won't encounter actually. We used to use it more in treatment of asthma before albuterol. They used a drug called theophylline. And this is a methylxanthine. Now, methylxanthines are very interesting drugs because they do a couple of things. They help bronchodilate the lungs a little bit, but they also help with the inflammation. They can inhibit certain type of inflammation, inflammation triggers. You may even find that it helps with allergies, methylxanthines. Now, one of the things I like about methylxanthines is you can actually use methylxanthines, a very small amount, in caffeine. Caffeine is actually a methylxanthine. You want to be careful with caffeine. You don't want to drink too much, and you don't want to typically give it to children with asthma. But teenagers, adults, older adults with asthma, a cup of coffee can actually dilate your airways a little bit as a methylxanthine, and it can be an anti-inflammatory as well. So, one of the tricks you can do if you are having asthma symptoms and maybe you don't want to use your rescue inhaler because it's not quite severe enough, you might try drinking a cup of coffee or a cup of tea that has caffeine in it. Also, the moisture and the warmth, I've had many patients tell me that it helps. So if you're a coffee drinker, now the catch-22 is this, is if you add a lot of sugar and cream and other things, you're adding other things that may cause asthma symptoms like dairy products. We didn't talk about this too much because there's not a whole lot of research on it, but asthma or dairy products can cause mucus production, or it can seem like it's very mucousy. Also, people have a lactose allergy, so it can cause asthma. So you might want to avoid cream, but if you enjoy a cup of black coffee, it could help a little bit. Another methylxanthine, and everybody's favorite methylxanthine, is chocolate. Chocolate actually contains a methylxanthine as well, although it's hard to reach any type of therapeutic levels with either chocolate or caffeine, but as a novel therapy, you might add it to your anti-inflammatory medications for regular maintenance or for intermittent asthma symptoms. Now, we may see some of these drugs in combinations. As I mentioned, Advair and Dulera are two popular combination drugs that include inhaled corticosteroids and long-lasting bronchodilators, which we're going to talk about on our next lesson, which is the bronchodilator lesson. Thank you for joining me, and I will see you on the next one.